Since 1947, Pullman has enjoyed the presence of a community hospital. Today, Pullman Regional Hospital is an acute care community hospital. We have 25 acute care beds, so in the context of how you measure the size of a community hospital, we're considered small. But we have a very broad scope of services at Pullman Regional Hospital. And that's one of the things that makes it, what we're able to provide for the community, robust and meaningful. The future of healthcare in almost every community across America is going to be challenged because of the high cost of healthcare in America. Some of the key funding sources for healthcare in our community, Medicare and Medicaid, continue to look at ways to decrease the costs that government has for providing healthcare to those segments of the population. What it brings about is a local reality of reduced services. Community Health 2020 is a plan, it's a vision, and it specifically is putting out a path whereby the healthcare that's provided in our region can have a self-determining, self-sustaining future. We see that we need to branch out. We need to make expansions into other parts of the healthcare spectrum. We would see including the idea of a Center for Women and Children's Health.
When children come into our office, the vast majority of the time they're coming with their mothers. So if we had a facility where it was easy for women to get their health care in the same building without having to load kids back up into car seats and drive across town and then have to go back to another place to do lab work, the more you can consolidate those services, the more likely they would follow through with preventative care visits, and so the child has a best chance of growing up to be a well person.
Accompanying that is the notion that we will have to learn how to do things differently. We will have to reorganize in order to branch out into the population health arena. So the establishment of a Center for Learning and Innovation is another part of the Community Health and Leadership Pavilion.
We're starting a pilot project where we're working with social services, where maybe they go to the patient to go in and talk to this patient about what their concerns are and what things they want to talk to the physician about before they ever get to the office. And then once they get to the office, following up with that and making sure that they're getting to those services that they need, that would get a person to their state of wellness. That should be our goal.
The Foundation Board will put their arms around this and work very strongly with the administration of Pullman Regional Hospital and all the staff in the medical profession. Everybody is really committed to this. I think it's just going to be really exciting to see how all this comes together.
This is the next step in getting our community to where it needs to be. We don't want to fall behind. We have to move forward while we have the opportunity to, before it's too late.
The urgency around Community Health 2020 goes to the point that continued delay will put us in the position of having to make critical decisions about the types of services and the level of service we can continue to provide. If we have to look at reducing things like access to inpatient hospitalist services or access to emergency orthopedic care, access to emergency and routine care by pediatricians, that has dramatic impacts on the nature of our community, the livability factor of Pullman and the surrounding region. We will have to make decisions around which of those can we continue to provide should we not have an alternative funding source that is a local solution. I think that's one of the compelling aspects around Community Health 2020 is that this puts us in charge of our future. The keystone component of Community Health 2020 and being able to create this self-sustaining, self-determining path is philanthropy. Philanthropy draws upon the greatest interest of people. It's a way for them to commit to things that are important to them.
Many people in our community have been lucky. My wife Beatrice and I certainly have. And philanthropy gives us an opportunity to give back.
And our hospital is not just a hospital, it's a great hospital. And it's there for all of us in the community.
The establishment of the Endowment for Quality and Access gives us that opportunity to continue to provide the services that are important for the community and not have to make choices that will leave some segment of our community lacking for care.
So an endowment allows you the funding on an annual basis to ensure that we have the absolute best access and quality of services for the future.
We see there's a possibility to actually establish an elective residency type of service here where physicians can come and do part of their training right here in Pullman.
Physicians really want to feel supported in a place that they work. And if a medical student can see that and compare that with other places in their training, they might think, well, that's a place that I think I would be happy.
And if students have a good experience in the community and they have mentoring relationships with the physicians, they can reconnect after they finish their residency program.
Included in our innovation efforts will be the exploration of how do we apply the technology that's now available through telemedicine. The use of audio and video capabilities to interact with patients. We believe there are ways that many of those specialties can have the capacity to reach out into some of the more outlying areas around Pullman. In the same way, telemedicine provides the opportunity for more specialty services to be brought into Pullman.
So if you have a patient who presents to our department with a stroke, we're looking at bringing in a robot that, with a screen that will allow the specialist on the other end of a monitor to see this patient, interact with the patient and the family to make the decision, which is a very important clinical decision on whether or not to deliver the clot-busting, potentially brain-saving medication.
Those technologies exist, we just need to get them in place and take advantage of that.
Now, I think I'm going to step outside my leadership role and talk as a husband and a father. 6 years ago, we were expecting our first grandchild. We were looking forward to sharing in that great experience. A month before our grandson was born, my wife Sharon suffered a stroke. We were at home on a Saturday morning and we saw the signs and rushed her into the hospital. Quality expertise in the emergency department at Pullman Regional Hospital saved her life. So that a month later, she was able to experience the birth in the same hospital of our first grandson. That's why Community Health 2020 is important to me. The building may be new, but the legacy is the same. And that's what we see as being the powerful part of Community Health 2020, is it really reaches in a significant way to build on what we've already done, to let the community show what it is committed to in sustaining a direction for healthcare that we have control over, that we can say this is how we want our healthcare to be. And we can make sure that those services are available for my family and everybody else's families and grandchildren for generations to come.